I wanted to talk about why most people will have shoulder pain. Because I'm primary care, integrative primary care, I have to make sure that when it comes to left-sided shoulder pain, it's not a heart problem. Aside from the heart, aside from the lungs, aside from the stomach, if it is just shoulder pain, then the majority of times when I see patients, it'll be a diagnosis of rotator cuff impingement. Whether the impingement to the rotator cuff muscles is accompanied by a bursitis or not, doesn't matter. Bursitis is just a nice way to say a little sac of fluid in the shoulder is swollen. But again, it usually is swollen because of something else, and that would be rotator cuff. Now, you have to be careful because rotator cuff can get pinched or impinged, and whenever a muscle gets pinched, or just think of your finger getting caught in a door, when it gets caught in a door and gets crushed or pinched, it swells up. It's painful to move, and the muscle will take some time to heal up. So same thing with rotator cuff. And this is looking at somebody from behind. This is the guy's head, this is the guy's shoulders and trapezius, and then this is what makes up the shoulder. Shoulder blade, also known as the scapula, sits usually about right here, and then the shoulder blade kind of floats on the back. It kind of floats on the back, goes out, goes in, protracts if you're Bruce Lee, you ever seen one of his movies, but it all sits here because it's supposed to be the bearing or the house for the humerus. The head of the humerus is a bone that sits like this. It's a very shallow ball and socket, and when the humerus, I'm going to kind of look down this way, okay? So when you have this glenoid fossa, this flat surface, it's a little bit concave, little bit, but it's only a little bit concave, like say compared to a ball and socket of the hip, where you have a totally enclosed ball and socket joint. Well, the one in the glenoid fossa and the humerus is shallow because you want more mobility in the shoulders. And with the little bit of the concave part, you'll also have a lip of labrum or cartilage around the edge, and that will give you the perfect seed for the humerus to come right in and sit, gently cradled, with a capsule in the front, tough tissue, capsule in the back, capsule underneath, and then muscles that kind of go over and cuff the shoulder. That's why it's called a rotator cuff. I'll have a picture later on of rotator cuff. Now when this thing sits properly and it sits perfectly right in the center with this pressure to the humeral head right in the center, it'll tolerate anything. It's bulletproof. The problem is that I've found if there's an impingement that starts or a shoulder pain that starts, you got to figure out exactly why it started. Sometimes it actually starts because the collarbone gets injured, or the joint between the collarbone and what's called the acromion. This little hook here is the acromion. That gets irritated. Like Luke Longley of the Bulls, his got totally separated. If you ever see pictures of Luke Longley's shoulder, there's a little point on his shoulder that goes up. That's because his clavicle and his acromion got separated from an injury, and he did fine. Or sometimes because it also depends on the way the muscles are controlling the shoulder blade. And that's where I'm going to kind of focus on here. I had a patient that, or at least somebody that asked me, kind of curbside me about his shoulder pain. Apparently he was been having shoulder pain. I believe he got a shot after after dealing with it for a while from a surgeon, and the shot didn't work, so I believe they assumed with either x-ray or MRI that there was arthritis to the head of the humerus. There was essentially no smooth articular surface. There's supposed to be a layer of cartilage over the head of the humerus and a layer of cartilage in the glenoid fossa. You put a drop of liquid hyaluronic acid in there, and that thing, because it's a closed system, will slide around perfectly lubricated for 80 years. If things are maintained properly and not breaking down like Mel Gibson did with his shoulder, popping it out, popping it in, you're going to damage things. Obviously it's only a movie, but you'll have people who kind of move, like baseball throwers and football quarterbacks. They move their shoulders out and torque them a little bit too aggressively. So when this guy had a diagnosis of arthritis to the surface of the humerus, I did not believe, I didn't hear the whole story, I did not believe that for his age that was the predominant cause. I mean, it takes years, decades sometimes, to have arthritis develop. And if the surface has been chipped for years at a time, okay, fine. Then I would expect pain for years. So I don't buy that. And I think fixing what seems abnormal on, I don't know if it's an MRI or just an assumption, fixing what seems abnormal might not get you pain-free. So the fact that you're going in with pain to some specialist that's a surgeon, I mean, I have a lot of great surgeons and I have a lot of great shoulder surgeons. But if you go to a guy that uses a hammer, everything that he sees is going to be a nail. So you got to be careful. I have fellowship training in musculoskeletal medicine, sports medicine, and I'm an acupuncturist, but I don't have an option to surgerize or fix surgically, so I have to maximize on everything right before that. And that's where I think that we are kind of missing the boat. I think a lot of patients that I see manifest something called scapular dyskinesis. Scapular instability or scapular dyskinesis occurs when this scapula, which is supposed to float up and down on the shoulder, and I'll show you a model in a couple minutes, supposed to float up and down equally, symmetrically on both sides. It's supposed to be able to do that based on how the trapezius muscles insert, how the rhomboid inserts, how the latissimus dorsi inserts, and on the front side, how the pectoralis inserts. Now, I just mentioned some very common names. And if you're a male 20-year-old guy who was an ex-athlete or a 30-year-old guy who's trying to get back to becoming a weekend warrior, you'll probably remember pectoralis, bench press. And I think that's the sine qua non muscle group that we all focus on when we're in our teenage years. So bench pressing is one of the only things that a lot of my guys understand. And for that reason, I think America or young guys overdevelop their pectoralis muscle. So when the pectoralis muscle in the front of this contraption is too overly developed and tight, then it pulls the scapula out. So let me show you on this. If this is a top view of somebody, so this is the scapula from the top, this is the head of the humerus from the top, and this is the collarbone or clavicle. Now, if your pectoralis muscles here and your backside's here, pectoralis muscles too tight or overly developed, you're going to pull the scapula out like that. And it's going to be sitting in a very unusual position all the time. If you sit like this, your work has a Google guy or a computer, somebody works on a computer 8 hours a day. And usually by the end of 6 hours, you're like this. Shoulders are forward, and you sometimes will kind of close the thoracic outlet. Well, that's not good because your shoulder blades come out forward. So if you happen to keep this position all the time, your back muscles, the latissimus dorsi, the rhomboids, will be overly stretched. Your front muscles, the pec, the serratus anterior, will all be overly shortened. So you'll actually, in time, keep this position even if you get up and do stuff at home. And then imagine you're going to go and do a home improvement job where you're painting, and you have to ask your muscles to go up and down. You have to ask your shoulder blade to go all the way backward. This is going to be impinged. So that'll take me to my next thing. What is impingement? Impingement, or pinching off the rotator cuff. Rotator cuff is 3 muscles. Technically 4, but 3 important ones. This is a magnified view of the glenoid fossa on the scapular shoulder blade, and then the head of the humerus, okay? You're looking at it this way. So this surface is supposed to be concave, semi-concave, not as deep as a ball and socket like a hip, but it's supposed to be caved. And then your head of the humerus is supposed to sit right in the middle of the concavity. Now if it sits up here, it's too much pressure on one side or another. Sits in the middle, it'll tolerate 80 years. The muscles that go across the front, the back, and the top, the subscapularis, the supraspinatus, and the infraspinatus, sorry. Those muscles make up the cuff. They're thicker than this, but they kind of go over the head. And when they go over the head, they're supposed to work properly to initiate movement, right? The problem is this little acromion here. There's a acromion that sits right here, just like this. Comes off of the glenoid right here, and it's supposed to be where the clavicle meets. But it can also impinge this supraspinatus muscle if you don't have enough proper movement. If you don't have enough proper movement, the supraspinatus, which fits right here, will be pinched off. If enough pinching occurs because of poor movement and the demand that somebody puts on a poorly moving shoulder, then you'll actually tear the muscle. Soon enough, after it tears, if it's chronic enough, it'll retract the edges, then you have a problem. Then a surgeon's got to take one end, take the other end, and kind of tie it together, and you have to be in an immobilizer for a short amount of time. But what I want to do is take care of people before that and work on the flexibility, the equal muscle balance, and the posture, especially at work. I'll put some links to proper ergonomics at work. I'll put some links to how to take care of muscle imbalance or trapezius muscle spasms. But you really have to find a physical therapist that is gifted in knowing how to work the scapular stability exercises, a surgeon who will look at the shoulder muscles in addition to just putting steroids in. I can put steroids in, but the problem would be if the steroids fail, if the steroids get to the spot where you want them, you put steroids in here, it decreases the inflammation, decreases the pain, but the pain returns in a couple weeks. It might be because you have a glenohumeral tear. That labrum I talked about, that piece of cartilage, if it's torn, you'll have temporary relief, and that little tear will cause pain all the time, so you have to get that fixed. And that's usually done or found with an MRI and contrast. But if there's no glenohumeral tear, and you just put steroids in and it helps temporarily, you got to take care of the scapular dyskinesis. Otherwise, you'll be having unnecessary surgery, and you'll be laid up after the surgery, and it'll cost you at least $5,000 to $10,000. I'd rather have you invest that in acupuncture if you're going to invest. And everybody that knows me knows that I dived into acupuncture when I first met Joseph Helms in UCLA. I was in my 40s, a little bit rambunctious, so I challenged him a bit when I went to his course. I was sitting there in the front, I had long hair back then, and I had a shoulder problem. And I'm sports medicine, so I did everything I could right before surgery, but I happened to take that course. I volunteered to be in front of 600 people, all anesthesiologists, a couple of sports medicine primary care guys. And he put a couple needles in me, and I tell you, with the few needles, I had better range of motion, pain-free range of motion on stage than I had in 18 months. The Chinese medicine in me, doctor in me says it's because he moved energy. The sports medicine doctor in me says it's because he was able to get me to relax my pec, relax some of the serratus and the trapezius imbalances, and thus, because I was able to move my shoulder up and down, the joint stayed stable. I didn't impinge my supraspinatus because the joint was moving properly and I was in it pain-free. That's the only explanation I have, but bottom line is that you want to take advantage of as much as possible conservatively before having to go for the scope, or even before having to spend $5,000 on an MRI where you have to get an arthrogram injected too. So if your deductibles are big, you're going to have to dish out some of that, and if it all fails in the long run after surgery, then you still have to go back to physical therapy and maybe even try acupuncture. So there's a couple of different options, but if you know what kind of questions to ask, how your physical therapist is supposed to be trained, ask the surgeon after he puts the steroids, before he does the scope, or ask his nurse, that might be more politely. How many shoulders does he take care of? Does he do shoulder rehabilitation? Has he had training in residency afterward for shoulders, fellowship training? I think that's all reasonable, but you want to be able to get to heal up 110% as fast as possible. So compression, the time frame of healing is real important, and I think getting to the exact diagnosis will be how you compress that time frame. Do a couple times. Here you can see the scapula, the medial border of the scapula moves up and down. That's really good movement. This one kind of disappears. So you lefty or righty? Keep on going. Tell the audience, you lefty or righty?
Lefty.
So when the arms are moving up, the scapulas move out. That's what's supposed to happen. Now stop, and then lift up front. So when the arms are going into flexion, the scapula slide forward. Do it a couple times. So he has what's called an anterior tilt. It means the scapulas are kind of tilted this way. Do up on the side again. Try to make it really even. but he's got a really good range of motion. The scapula, you can see him because he has good muscle mass and low body weight or low body fat. The scapulas go up. So the scapula is always trying to keep a good position for this humerus. And his lats are not too tight, so they're not pulling. The pectoralis muscles in front are not too tight or overdeveloped, so they're nice and loose. And the serratus anteriors are nice and well balanced in addition to his traps. Okay, thank you.